So I wanted to explain to ladies what it is, what blood work really is. Like, what does it really capture and what does it not capture? Because I feel like sometimes we like hang our hat on something like blood work, either being like, it looks good and so there must be nothing wrong, right? Even though our body is telling us, no, there's something going on. Like, I'm not feeling well. And you go into your doctor and they do the blood work and they're like, this blood work looks great. You're fine, you know? And then you go home and you're like, I'm just not fine. I know myself. I don't feel good. And what's really unfortunate about that situation is that you might even feel like you might know deep down inside that something isn't well. And then this situation comes along where your blood work looks normal and it makes you second guess yourself, right? So you start to doubt yourself. You start to lose touch with that inner intuition, that body wisdom, right? So I want to explain to you how it is that that could happen, that you might not be feeling well and your blood work looks normal. And then I'm going to go into the other situations I mentioned at the beginning. But first, we're going to start with that one. Okay. So blood work is basically you're taking like a sample from the blood. And I know that sounds really simplistic. But I want you to understand that the blood is, a lot of things happen in the blood, but primarily a lot of that, the things that we're testing for is like the blood is like the highway, right? So the blood is carrying, is like a transport system, right? Transporting things through the body primarily. But the magic, like the chemistry of most things, happens in the tissues, right? It doesn't happen in the blood. There is stuff that happens in the blood, but it's generally not what we're capturing so much with the blood work in terms of what we want to know. So for example, I'm going to use the example of thyroid, okay, because that was the question about Hashimoto's thyroiditis. So just so you know, Hashimoto's thyroiditis is the most common autoimmune thyroid disease. So when the body attacks its own thyroid for various reasons. And what happens is eventually the person initially could go hyperthyroid, like overfunctioning, because it's kind of woo, and then it goes hypothyroid. So you end up having not enough thyroid hormones. However, so that when you go hypothyroid and you don't have enough thyroid hormones circulating in the blood, right? That's when you get the diagnosis. So you can actually get a diagnosis of Hashimoto's thyroiditis even if you're feeling well, if your blood levels of the thyroid hormone are low. Okay, so that's very interesting. So it's actually a disease that could be diagnosed even if you're feeling well, and that's a blood level disease. However, what is really cool is that every single cell in the body has a receptor for the thyroid hormone. It's that important. It's like super important hormone. And there are various conditions that we know of, as one example being stress. So if you're really highly stressed, mentally and physically, that actually alters the sensitivity of the thyroid, the receptor to the thyroid hormone. So you could have totally amazing like blood work, but that hormone that's circulating in your blood is not working for you at the level of the tissues, and the blood work will never tell you that. So if you are feeling like you might be hypothyroid, like, you know, you go online and you read about it and it's like dry skin, low energy, difficulty with maintaining your ideal weight, loss of hair on that outer third of the eyebrow, that's a big tell. And you go in and your blood work looks good. I want you to understand that that doesn't mean that your body is like functioning in its optimal state. Okay. And all that means is that, okay, like my condition hasn't reach the point where it would be diagnosed as Hashimoto's thyroiditis. Like, I don't have this diagnosis. However, there's something going on. And if the clinician that you're working with, be it a doctor, a naturopathic doctor, a functional medicine doctor, if that particular individual can't help you figure it out, it's simply because that there are scopes of knowledge, right? I mean, it is impossible, like really impossible for one doctor, right? And if you're joining me, please say hi. It'd be wonderful to see where you're from. It'd be really impossible for that one doctor to know everything. So it's just like if you start a business, right? and you have like all of these employees and you know you need like a CFO and a CEO, and you need your accountant, and you need the person at the front desk and the secretary and the treasurer and all that kind of stuff. You're not going to find one person who has all of those skills, right? So you keep working with the person that you're working with until you get a sense that you need to like find someone with like another set of expertise to add to your team. You want to grow your team out. And the body never lies, okay? If you're not feeling well, something's up. And I gave the thyroid as an example. And other things that can interfere with thyroid functioning at the level of the cells is like, let's say your mitochondria. The mitochondria are like are like the batteries in our cells. They produce energy. If you have something that's gunking up your mitochondria, like let's say alcohol can do that, mercury can do that, from the environment, then again, even though you may have normal blood levels of a hormone, even like insulin, for example, when it comes to diabetes, if you're still experiencing something that's not going well with you, I encourage you, I invite you, I really, really I empower you to just keep asking and keep looking and keep questioning and you know what I mean, like until you get your answer, because this is what I do know about health. Okay, what I do know about health is that life, like the force of life that flows through us, right, from the time we're born to the time we die, its natural state is health, like real health. Its natural state is lack of disease, right? So when we deviate from that natural state, there are only it's done the research of all conditions, only like 5% are truly genetic. The rest is like the interaction between genes and the environment. So most likely, if you're experiencing any kind of disease, with very few exceptions, it's something to do with the environment interacting with your genes. Well, what can you change? You can change your environment. So if you're not in a state of like vibrant health, you have to have like a moment of radical honesty with yourself and say, okay, there's something going on, and I'm either going to prioritize myself and look into it, or I'm going to sit back and let things kind of continue. And let me tell you, if you're feeling unwell and you let it continue, chances are you're not going to feel like much better over time. It's just going to get worse. So I encourage you, again, I just want to repeat this. If your body is telling you that you're not well and your blood work being done by your clinician is normal, I want you to trust your body. And then the next step is, if your clinician is not on board with trusting your body with you, then you have to like thank them, mentally thank them for the services that they've rendered you. To at least know that your blood work is okay. So like on some level, there's certain things that you've ruled out. And then you have to go searching for that additional person to add to your team to see if you can figure this out. And you gotta interview doctors. Most functional medicine and naturopathic doctors will allow like a 15-minute like a meet and greet kind of session that's free. And you can like actually tell them, like, in the 15 minutes, you can give them the example and say, listen, I'm feeling this. My blood work is normal. Can you explain to me what it is that you would do? Like, what is your like top things that you think might be going on? And what kind of plan would you create for me? Because I want to know that you are, now you're able, you don't want to antagonize them off the bat, but I just want to know that this is going to be a good working relationship, right? Okay, so that's the first situation that we've covered, where you're not feeling well, you go in, your blood work is looking good, and you have to trust your body. Okay, now we're going to go into the second situation, which is you have a diagnosis, right? And here's the second situation I want to go through first, actually. So let's say you're not feeling well, you go in and the blood work is normal. Okay, so there's some limitations to that. So especially if you live in Canada or the US, and I'm not exactly sure with like certain other countries, but I think this is pretty standard. So what happens is the laboratory so your blood gets taken, it gets sent to the lab, and the lab analyzes your blood, right? And it gives you a value for your blood, and then it says this is the range of normal. So it says, okay, below this range and above is not normal, and above this range is not normal, and there's a range. And then the doctor, like myself, is trained to look at the range and say, okay, well, you're within the range, so you're normal. Okay, first I want you to understand that most of the ranges in the blood work, especially when it comes from the thyroid and that kind of thing, do you want to know where they get that range from? The laboratory gets that range from all of the blood work that's been sent there. Okay, so who gets blood work done? Is it like super healthy people? No. It's people who come in having problems with their health. So there is a portion of those people who are healthy. Maybe it's like a yearly checkup or something like that. But the people who tend to get blood work more frequently are the people who, like yourself, are coming in with a problem. So then what you get is you get this range of a mixture of like healthy people and people with a problem. So you can get this like wider range that might actually capture like not the ideal value. So you don't want to have within a normal range. You want to have a range that's optimal for your body, right? Like you want to be in vibrant health, okay? So I'm going to give you an example. Functional medicine, if you haven't heard of it, is a branch of medicine that has really blossomed as a result of people getting really sick, including doctors and their loved ones, and they just couldn't figure out why. And there's like a portion of these doctors who were just not satisfied with the status quo. And I like, that was my story. So when I found functional medicine, I was like, oh my goodness, this is it, you know, and I'm doing my training in it. And so what they did, what they call themselves like root cause medicine, it's like, okay, you're unwell. Why? Not just like, here's the medication for it, right? But why did you get here? And sure, we might need medication to bridge you until we find out the reason why. And in some people, you might need it for life. But until we like get to the root cause of it, we can't say that for sure. We have to keep investigating until we figure out the why and then the solution to that. So it's a very like solution-driven kind of medicine. And what they've done is they've looked at the research and they've pooled like their clinical expertise, and they've developed what they call optimal ranges. So I'm going to give you one example. So the thyroid stimulating hormone, okay, is the hormone that one tests, like the doctor tests first to see is there a problem with your thyroid, okay? And if the level is too high or too low, then they go on to test more. But so I'm going to talk about that next. But so the thyroid stimulating hormone, and so you test this, and there's this huge range, right? It's like 1.8 to 5 or something like that in Canada. In the US, it's different numbers, metrics that I'm not familiar enough to just spout it off. I'd have to look that up. And there's like this sheet that we have, that functional medicine doctors have, and we just compare and say, okay, what's optimal range? Well, according to the laboratory values of like the healthy and people with problems coming in to get their blood work, the optimal range is 1.8 to 5, just as an example, right? 2 to 5. Well, in functional medicine, they bring that down to 2.5. So you want your range between like a 1.5 to 2.5. And if you have higher than that, okay, which means that your body's trying to stimulate your thyroid more. So your thyroid isn't working well, your body's trying to stimulate the thyroid. It's the thyroid stimulating hormone. If it's too high, you're thinking, what's wrong with the thyroid? Okay. So and then if that's too high, then the medical system goes on to test more hormones like T4, which is and T3, which are the hormones that are produced by the thyroid. So the thyroid is stimulated and it produces these hormones. So in conventional medicine, let's say you get a value of 4 for the thyroid stimulating hormone, the conventional doctor is actually technically not even allowed to treat. Like the laboratory will cancel the study for the T4. So they don't even get the number most of the time. Okay, so all you know is that the thyroid stimulating hormone is within this range, but you still don't know how the thyroid itself is doing because it's an indirect measure. It's like just telling you whether or not it's stimulating very high or very low. And there's this gray range where you could still be having a problem. Okay, let me know if you have any questions so far, okay? Okay, so now let's say, so then a portion of you who are feeling like you're hypothyroid, for example, or hyperthyroid, for example, and that blood work is like within the standard range but not the optimal range, your doctor may stop investigating at that point in time, and you go home, you feel unwell because your blood work is normal, but you're still having problems, okay? Okay, then let's say your thyroid stimulating hormone is so high, like a 6 or a 7 or higher, that your doctor's like, okay, now we're gonna go test more. So you go test the T4, okay, which is essentially 4 iodines on a thyroglobulin. So it's T4, 4 iodines. That's why iodine is so important for thyroid. The thyroid needs a lot of iodine to make its hormones. Okay, so you test T4. And so now you know what the T4 level is circulating in your blood, but did you know that the actual hormone that is responsible for a large portion of the thyroid's effects is T3? And that a blocker of T3 is reverse T3, which is created under certain conditions such as stress, for example, right? So here you are, you could, in fact, let's say you go to a naturopathic or functional medicine doctor, and they do the entire panel. They do TSH, T4, T3, and reverse T3. Okay, in conventional medicine, you would get TSH, maybe T4, very rarely T3. Okay, but you wouldn't get reverse T3. That's not standard unless you ask for it. And I have had some family doctors do it if asked. And let's say all of those are normal, and then reverse T3 comes back high. Then you know, okay, like it's the action of is being blocked by reverse T3, and one of the reasons that reverse T3 goes high is because stress causes a conversion of T3 to reverse T3. And then let's say it's all normal and you still don't feel well, you still feel like something might be up with your thyroid because you feel hypothyroid, like there's all the signs and the symptoms are there. Remember that first example is that there is a certain interaction of the hormone at the level of the tissues, and the blood only shows you the highway. It doesn't tell you what's happening in the factory, so to speak, which is the tissues where the magic happens. Okay, so it is important when you have this sort of situation arise to understand that there's a certain amount that the doctor can do, and then there's a certain amount that you can do, and it's what you can do that really matters. So if you're not feeling well, you have to really go back to the basics of health, right? The foundations of health. And you either know those foundations and you haven't been applying them as diligently as you would like to perhaps, or you're not like confident with the knowledge that you have, and then you have to go seek more knowledge, right? And that's where I encourage you to just keep asking, like, remember when we were children and we kept asking, like, why, mommy, why, you know? That's kind of where we have to get back to. We have to get back to and say, like, why am I not well? If the principle of life is health, like that's the flow of life, and I'm experiencing disease, where is that energy flow, that flow of life that should be permeating every cell of our body, is starting to break down, right? Like, where is it being blocked? Where is it being inhibited? Where is it being limited? Where is it being sabotaged, right? So, and I can tell you that, again, with very few exceptions, around 5% of it being purely genetic, the rest of it is environmental. So what does that mean? It's something that you're doing or is being done to you through the environment. And it usually boils down to what you're eating, what you're drinking, how and what and when you're eating and drinking, how and when you're sleeping, how and when you're moving, what is your mental state, what are your stress levels, right? How are you helping your detoxification systems and minimizing the burden? So those are all the things, like you'll see, like that's the root cause medicine. So again, we start off at the top feeling unwell, confused about the blood work, dig deep, and then figure out what's going on. And then the other one to consider always, of course, is infections. So, you know, you have to work at the foundational things, because oftentimes when you work on the foundation, your body's like a garden. It's not going to tolerate certain infections if it's in thriving health. It'll just kick that organism out, right? So I always kind of get back to, it's like, get back to the foundational health. And when you've really worked on that and you're really confident you've got that, then you can then you can say, what's left over, right? Like, this is what I have. I've done everything, and now, like, oh, all of this has gotten better, but there's this left over. And then you can go like searching more, like another functional medicine doctor, a naturopathic doctor, or a conventional medicine doctor who has gone beyond the boundaries of Western medicine, to be able to offer you more beyond what the blood work can tell you, right? Or the regular blood work. And I just have to say, Morgan says, you're blowing my mind right now, and thank you. Sometimes I feel like I'm talking to myself and I don't really know what kind of impact I'm making. So I really appreciate that, Morgan. I appreciate that so much. Thank you. Okay, so I think I've covered quite a bit already, but I'm going to add one more because it belongs to this topic. Is, okay, let's say you have a condition, and let's use example hypothyroidism example as another example as a condition. Women are like, I think 3 to 7 times more likely to have thyroid disease than men. And we don't know exactly why, but it probably has to do with the balance of our hormones, our double X chromosome, right? That kind of thing. So, but it's interesting to note. So I think this topic will probably be relevant to a lot of people, but you can insert any condition, right? Like any condition, you're on a medication and you're just not doing well with that medication. Okay. And what I really would hope, what I really would wish for you is that should you go into your doctor and you say that, the doctor listens to you, because again, the body never lies. It doesn't know how to. You know, I just really can't say this enough. Like, your body is this beautiful, intuitive sensing organ, and it can't speak. It has no language. So how does it express itself? It expresses itself through the body, through physical signs and symptoms or mental disturbances, right? So you have to tune in. Many of us have blocked. So when we go to the doctor and we're like, oh, I've got this like rash on my knuckles, right? And let's say the functional medicine doctor, naturopathic doctor, conventional medicine doctor is like, well, like, how stressed are you? You know, and you're like, well, I'm not really stressed. And they're like, well, what do you do? You're like, well, I work a full-time job. I have like parents that are sick or I'm taking care of, or I have children that I'm taking care of, or I have all of these commitments, and I'm exercising 4 times a week, and I'm sticking to a really strict diet, and blah 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 blah. And the doctor's just like, okay, like, you're stressed out, right? Maybe that's contributing to your eczema, which we know does. And then you're just like, no, I'm fine, right? It's because you've disconnected the head, the mind, from the body, because your body probably at some point in time started to talk to you, and rather than tuning in, you tuned out. So we have to tune back in. So again, if you are on, if you have a condition like hypothyroidism and you're on the medication, so here's an example, levothyroxine or Synthroid, that's T4, right? And I just told you that T3 is responsible for a significant amount of the action of the thyroid at the level of the tissue. So if your problem is that you can't convert, you can't turn T4 into T3, which is what the body does naturally in order to get T3. Let's say there's something that's blocking it, like a nutritional deficiency from, let's say, a hormonal contraceptive. You've drained your resources and now they can't do that conversion. Well, you're taking a lot of T4 and you're not converting it, so you still don't feel well, right? Or let's say you're on the T4 and you're converting it to T3 and you're super stressed out, so it turns into reverse T3, or it doesn't work at the level of the tissues, right? So do you see where I'm going here? It's like, it's all about tuning in, getting super familiar with your body, understanding, and not leaning away from it, like not retreating from it in fear, which is kind of what we do. It's like this core wound that we have of like fear of death, and so we, you know, sometimes we ignore it because we don't want to touch that, you know. But you know, that what we're saying these days is so true. You have to lean in, you have to listen up, you got to take ownership for it, take responsibility for it, accept it, don't judge yourself. There's no judgment here. It's just awareness, like raising your awareness and then moving on, right? And then asking the questions, the why, and like kindly, right? I mean, conventional medicine doctors, we are taught a lot of stuff, and it may seem like a lot of years of training, but it's barely, like, it's not a lot, you know, and a lot of that is dedicated towards the study of drugs. I hope that in the future that a big, huge portion of that gets redirected towards the study of root cause medicine. And then functional medicine training is like an additional year to 2 years, or even 4 years, depending on how quickly it takes doctors to go through that. So I'm hoping that in the future, more conventional medicine doctors will go through the functional medicine, so that when a patient like you comes to them and says, my body is telling me that something's up, even though my blood work looks normal, or you're on the medication that is supposed to work for me, that they're going to be able to say, okay, let's dig deeper, let's do more, let's see if we can. And really what they should be doing is sitting down with you and going deep into your lifestyle, right? And that's, for example, that's what I do with my clients. Like, I have them fill out a whole bunch of questionnaires and we do a deep dig. And that's what my programs are centered around, is teaching you that foundational knowledge so that you can gain the wisdom to be right in your self-governance, right? You want to rightly be governing yourself and monitoring yourself and being self-aware, so that you can then reach out to the people that you know can help you and then actually fix the problem, right? Because your problem is not a medication deficiency most of the time, right? Your problem is something happened at a root cause level that had a downstream effect. Now it's displaying itself. There's a temporary need for a Band-Aid, but you got to get at the root of the bleeding, okay? And again, like, blood work is like a tiny little honing in on something, right? Same thing with even MRIs, right? And that's a whole other topic. I'm a specialist in physical medicine rehabilitation. I can't tell you how many times we've done an MRI of a brain of someone who has had a concussion, let's say, and they continue to have problems. And I'm like, yeah, it's a picture. You know, if I take a picture of my computer, it doesn't tell me if it's working or not. I have to actually turn it on and run diagnostics. It's the neural networks that matter, the functioning of the neural networks, right? So same thing with the blood. It's the functioning of the tissues that matter, okay? So we have certainly come a long way in Western medicine, and we have a very long way to go yet. And I think it's that humility, you know, it's accepting that when someone comes to us with something that isn't jiving with like the blood work or the imaging, we don't question the patient. We just recognize the limitations of our investigations, right? And then we have to continue to learn and continue to educate ourselves and go beyond our training to expand our field of knowledge, or say, you know what, I'm going to put you in contact with someone who I think can help you, and let's try this together. Let's expand our team, right? Let's work as a team and get this sorted out, because you know what, you're worth it. You're absolutely worth it, right? The world needs healthy, thriving people, healthy, thriving women, okay? So I hope that you found this talk helpful. Please let me know if you have any questions. If you are watching this after the fact, you know, put your questions in the comments. I am limited by how much I can answer your questions after the fact, simply because it's hard to type things out, right? What I can do though is if questions come up, I can always create videos and post them out. And so if you can join these live, that's great. If not, put in your questions and I will keep track of all the questions, and I'll keep adding value to this group and making sure that you're getting your questions answered. Okay? So I hope you're having a really wonderful day, evening, or night, and I look forward to seeing you on Facebook soon. Bye.